Welcome back, everyone. Could you imagine living your life as routinely as you're used to, and then suddenly you feel discomfort, bloating, weight gain, and a lack of appetite? Something is very off. In 2009, I was diagnosed with stage 1C ovarian cancer, and those symptoms that I listed confused me, and I had no idea what was going on until a doctor told me it was ovarian cancer. In honor of Ovarian Cancer Awareness Month, we have Dr. Paulina Ramirez with UT Health San Antonio MD Anderson Cancer Center. Thank you so much for being here today, as we are together in teal is what I like to say. But doctor, why is ovarian cancer considered such a silent killer?
Yes, Roma, thank you so much for having us today. So ovarian cancer symptoms are very vague. So unfortunately, a lot of the times our patients are diagnosed at a later stage when the cancer has spread to your other organs in your abdomen, which is why it's considered a silent killer.
Because oftentimes once it's diagnosed, these tumors can grow so quickly and or the cancer could spread. That's kind of, in my case, I had no clue. Like literally when they told me, I was like, what do you mean this is cancer? I check up on my health quite often, and that's what I wanted to get into as well, is that there's no actual screening for ovarian cancer the way there are mammograms for breast cancer, right?
Correct. So unlike cervical cancer, where we recommend pap smear screening routinely, for ovarian cancer, there is no recommended screening guidelines. So that's why you have to be really in tune with your symptoms and the risks that go into ovarian cancer so that you can talk to your doctor as soon as you have those symptoms.
And just following up with what you're saying, I had just received a pap smear 3 months before my cancer diagnosis, and it was not detected. So we don't want to scare anyone in the audience. Whenever we do these segments, I want to remind the ladies, you know, it's more to be aware of your body and know the symptoms. And so can you list some of those symptoms for us?
Of course. So if you're experiencing bloating, persistent abdominal pain, pelvic pain, issues eating, or feeling full faster, or any urinary retention or urgency, you should definitely seek medical care and talk to your provider.
I think it's as simple as knowing your body, right? And it's so scary to think that something could be off, but you know, and I knew something was very off. I had a lot of pain, I was so bloated. And so I think that message is what I hope today that our audience can get, especially you're a testament, you know, you are teaching women all the time and, you know, learning about diagnosis and all that. So what can we do as women if there's no screening? Just be aware, and then are there risk factors as well?
Correct. So you are your own advocate, and you need to talk to us when you do have these symptoms, especially if they're persistent. There are risk factors, however, so women that are middle-aged or older are at a higher risk. Women who have a family history of ovarian cancer as well. Women who have had issues giving birth or never have given birth are also at high risk.
Okay, and can a history of your genetics give you a heads up in some way?
Yes, it is important to know your family history. Some of our patients and community don't know their family history, but there is a genetic test available. It is a blood test, and it is available, and it can tell you if you are at high risk for ovarian cancer. It cannot diagnose cancer, but it can tell you if you are at high risk.
So then my question is, if you know you're high risk, what does that mean for you? What do you need to do for the remainder of your life?
Yeah, so you potentially will have to get more surveillance, and you need to talk to your doctor about that to make sure that you are getting that surveillance.
So basically be more aware, because you could be, if you feel those symptoms, you could be the higher risk at actually getting ovarian cancer.
Correct, or if you have a family history of ovarian cancer, for example.
And what do some of the treatments look like? I mean, for me, I did surgery, removal of my tumor, and then chemotherapy. Is that the case for most women?
Yes, it is important that we talk about the fact that ovarian cancer is treatable, and so then treatment includes surgery and chemotherapy typically.
And I'm testament of that. I'm so blessed by God to be here today. So always just hope that women will listen to their bodies and make sure and go to the doctors and do not be embarrassed. I think embarrassment and shame comes a lot with those things that we're so unfamiliar with.
I agree. And I think as women, we prioritize our families, our career, and sometimes we don't prioritize our health as much as we need to, right? So I think today that is what I would like to stress, that you need to prioritize yourself and be an advocate for yourself, especially when you're having symptoms that are worrisome.
Sure,
and persistent.
We may have, confused women a little bit or scared them more maybe because it is scary to talk about, but it's real life, it's our bodies, and we got to take care of them. What are the screenings then or the options for detection?
Right, so So when we're working a patient up for ovarian cancer, we usually do a pelvic exam. We recommend imaging such as a transvaginal ultrasound, CT imaging, as well as blood work.
Okay, well, thank you so much. It's a wealth of knowledge for our ladies in the audience and even the men. You know, be an advocate for the ladies in your life as well. Thank you so much, Doctor.
Thank
it
you
was
so
great
much,
to have
Roma.
you here.
Thank
And
you
don't
so
forget,
much.
September is Ovarian Cancer Awareness Month. Great day, SA. We'll be right back.
Thank you.